Hi, this is Dr. Sham. I'm a rheumatologist from Chennai. So now we are going to see the one of the commonest arthritis. So we spoke a lot about rheumatoid, psoriatic. Actually, the commonest arthritis around the globe is osteoarthritis. So this is about, as I told, simple thing for you to understand is wear and tear. Whether it is a knee joint or whether it is even the small finger joints, everywhere joint is nothing but where two bones meet. So when two bones, bones are like pretty hard, so they can't rub against each other. So naturally we have something like a cushioning structure in between that is called cartilage. So in a joint, both, if these two are the bones, both the ends will have something called cartilage. So due to abnormal activity or trauma or with age, these sponge like things in between repeatedly goes for wear and tear. They keep undergoing damage over a period of time. They get worn out, so there won't be any cushioning effect. It will be bone on bone, whether it is in the hands or whether it's in the knee, hip, or even in the spine. So the typical symptom with osteoarthritis is initially the patient will be having pain with activity, unlike a rheumatoid or a psoriatic where the patient will have pain after a period of rest. Here pain will have be at the activity, and once they take rest, usually the pain eases down. They can also have stiffness like a morning stiffness, but it won't be prolonged unlike a rheumatoid or psoriatic arthritis. So patient can have a morning stiffness, but it will last just 5 to 10 minutes and it will come down after that. Usually joint swelling won't be more pronounced like the rheumatoid. There can be some amount of mild inflammation or mild swelling, but usually it won't be more pronounced. So again, osteoarthritis, remember, it is not just knee, which is very common. I do accept in India. In Western, it's more of hip. But other than these joints, because these are weight bearing joints, patients life gets affected. Otherwise there are other joints, particularly commonly many times we see the hand arthritis or foot arthritis. Usually we may not give much importance because these are not weight bearing joints. But sometimes people, when the joints undergo deformity, they get scared. But good or bad, only thing is osteoarthritis is not very dangerous. At the same time, you don't have very lot of options for treatment also. We'll come to it maybe in the next video. Like, so osteoarthritis is a common arthritis. Usually it happens in our elderly people. Doesn't matter whether it's a male or female. Sometimes some people, for example, can have an injury, like you can have a knee injury, you can have a ligament tear or a meniscal tear. So those joints can have a faster wear and tear. Instead of you developing, any of us developing osteoarthritis at the age of 60 or 70, they tend to develop at early age. So somebody develops osteoarthritis at early age, we have to think of secondary causes, because it's not just age. So whether the patient had, as I told, trauma, ligament tear, or the patient had a rheumatoid or has a rheumatoid because of which they have osteoarthritis. So pain with activity, better with rest. Totally opposite of rheumatoid arthritis. This is the this one. And once the joint becomes more damaged, sometimes it can go in for a deformity. Many times knee and all, you can see it will be something like a C shape. Patient will itself, while walking, they will be swaying towards both sides. So thank you. This is about osteoarthritis.